So for our discussion today, we will be discussing your complete blood count. So one of your asynchronous activity was to watch a video wherein you would write or report the different components of your CBC. So one of those required for your CBC class would be your leukocyte differential count, also known as your WBC differential count. Now, for this one class, you would be doing differentiating. When you say differentiating, you're going to separate each type of WBC. Now, I'll be discussing that on a broader and specific term later. So, the first thing you need to do whenever you're going to perform your WBC differential count is to prepare your blood smear. Your blood smear. Now, there are two types of blood smear. We have your thin smear and your buffy coat smear. Now, your thin smear class, this is the one that you would be using in your differential count. Now, it can also be used in the detailed study of your RBC morphology. So when you say morphology, this would involve the RBC morphology would usually involve the variation in size and in shape. So when you say size, is it normocytic? Is it microcytic? Is it macrocytic? While for your shape, this would define the type of shape. If it is a target cell, if it is a dacrocyte, is it a sickle cell, and so on. Plus, by the way, if mag-choppy ako, kindly inform me. Then it is also used for your indirect platelet count. So your indirect platelet count class, I've discussed this. It uses your magnesium sulfate. You'd be using a smear, then you'd be mixing the blood with the stain with your magnesium sulfite, and then you're going to make a smear. Then reticulocyte count, siderocyte count, I'll be discussing this in the future. And your search for your malaria parasite. Plus, give me the four species of your plasmodium. Oh, noted me sa yan. Give me the four species of your plasmodium class. You still recall your parasitology. What are the four species of your plasmodium what? Okay, you have your malaria, your vivax, what else? With the other two. Okay, one more. Okay, falciparum ovale. Okay. Then there's also nolesi, but nolesi. Pero mas common kasi yung apat. Now, usually class, your vivax and your falciparum would be the first ones you. So, they would appear inside your RBC class. Minsan yung tropocyte niya would banana shape pag sa falciparum. So you could use your thin smear for that. Now, another one would be your buffy coat smear. Now, remember your buffy coat is found in the middle. So, di ba, pag sinentry niyo yung full blood or yung EDTA, you would have your red cell component. Then, in between the red cell component, there is a white creamy layer, thin white creamy layer known as your buffy coat. Then, this one, with the liquid part, is your plasma. So, you'll be draining, tatanggalin niyo yung plasma, then you would get the buffy coat. Then using the buffy coat, you're going to make a smear. Now, this is usually used in cases of leukopenia. Now, why leukopenia? Remember, pag may leukopenia ka, your white blood cell are decreased in your peripheral blood, meaning yung white blood cell nyo dun sa red cell part is decreased. So you need to know a more concentrated you need a more concentrated specimen. So remember, your buffy coat has WBCs and platelets. So thus, you would use the buffy coat if there is a decreased WBC sa peripheral blood. Then it can also be used for the search of your lupus erythematous cells. Now, what's with the lupus erythematous cells, class? Your LE is this is a systemic disease. If you ever know someone with lupus, they would be characterized by a butterfly rash. Now, si butterfly rash nyo, class, the butterfly rash nyo would be seen on the cheek. Now, along with your lupus, we have your LE cells. Now, your LE cells, class, would look like this. Whenever they would get phagocytized by WBCs, kakainin sila ng WBCs, they would push the nucleus of the WBC. Itutulak nila yung nucleus ng WBC sa gilid. Thus, you would easily visualize them. So normally, class, ito yung nucleus ng neutrophil nyo. Now, remember, your neutrophils can phagocytize. Kumakain yan ng foreign materials or foreign bacteria. So, once they eat the LE cells would then push to the side the nucleus of your WBC. Then it can also be seen in megaloblasts in cases of pernicious anemia. So when a patient has pernicious anemia, you would be able to see blasts. Blasts, class, are young WBCs, mga batang WBCs. These are young WBCs. They are very big. These are your blast class. And they are often seen in your buffy coat. The best specimen to see them is your buffy coat smear. Kasi again, your buffy coat is a concentration of WBCs and platelets. This is the appearance of your blasts. Then another one would be blast cells in leukemia. So leukemia class, you have what you call a overproduction of WBCs. Now, kapag produce kayo ng WBCs, sa sobrang dami niya, even the young cells can easily be seen. And then phagocytized pathogens in case of meningococcemia. Class, what is the bacteria known to cause your meningococcemia? Anong pangalan ng bakteryang yon? Any ideas if you recall your micro? No worries, Ms. Bejarano. No problem. What do you call the bacteria known to cause your meningococcemia based on your bacteriology last year? If you still remember or if this was taught sa klase nyo. Alright, so your Neisseria meningitidis. Class, follow-up question. Your Neisseria meningitidis, what is the gram stain reaction? What is the gram stain reaction of your Neisseria meningitidis? Alright, so gram negative. Now, your Neisseria meningitidis class are gram negative. Intracellular. So, inside the cell, intracellular oxide. So they would usually be seen inside the cell. What cell? The WBCs, specifically your neutrophils. Now, this is the appearance of your Neisseria meningitidis inside a WBC. They would usually be seen in WBC's class. That is why the best specimen or the best smear for that would be your buffy coat smear. Now, you have to make your blood smear. Okay, so I'm going to show you how to make a blood smear. Wait lang. Gulo na ng workplace. Using ko lang. Now, class, in making your blood smear, you have to wear your PPE. So you may enlarge my screen if you want to further see what I'm doing. So you have to wear your PPE, your lab gown, your gloves. So once you've had your PPE, now you need to prepare your materials. So the materials you'll be needing are your slides, your specimen, and your applicator stick. Now, depending on the type, you may use on how you will transfer the blood. Kung paano nyo ita-transfer yung blood sa smear, you may use different apparatus. Pero sa amin, we would use applicator stick. So the first thing you need to do is to label your specimen. So let's say the name of the patient is Miss Adrian Ilisan. So the name of the patient is Adrian Ilisan. So you label it the full name. You may even start it with the last name followed by the first name. Now, after you've labeled that class, you have to now prepare your smear. Now, you now proceed to your specimen. You check your specimen if it is underfilled or overfilled. You check if it is hemolyzed. How would you see if it's hemolyzed? It would tend to be pinkish. Then you check if there are clots, kung may clots or wala. If there are none, you would then proceed to transferring the blood. Now, how would you transfer the blood? You just don't pour blood like that, class. What we do in the laboratory is that we use an applicator stick. Now, using the applicator stick, class, we would dip the applicator stick. Then we would put the blood at the topmost part of the slide till we form a single drop of blood. So, tansyahin nyo, class, yung size ng blood. It shouldn't be too big of a drop, nor should it be a too small of a drop. Tamang, tamang size lang. Once you put the drop of blood, you would face the slide towards you. Then using another slide, this other slide would be now known as your spreader. Spreader meaning ikalat. So you would slide from the bottom to the top at an angle of 30 to 40 degrees. Then you slowly spread the blood. And then at an angle of 30 to 40 degrees, the angle na 30 to 40 degrees, you would slide it down, making your smear. Pangit ng pagkagawa ko. Sorry, class, greasy ng slide. So that's how you make your blood smear. Then you air dry that. So these are examples of slides I made. This is for the patient Trixie Destacamento and patient Kate De Latina. So ulitin ko, class, ha? One more time. So prepare your slide. You label the slide. Let's say Miss Claire Amar. Be a good patient. And then once you have your blood, once you have labeled your slide, check your blood for any problems, if there are clots, if it is hemolyzed, if it's underfilled or overfilled. After that, you place the drop of blood. Then using your spreader, Using your spreader, you would spread evenly, and at a 30 to 40 degree angle, you would smear. So, ang pangit ng paggagawa. So, pasensya na. At pangit na rin yung specimen ko, class. It's all. So, that is how you would make your blood smear. Any questions? Naintindihan ba? Okay. So, back on topic. So whenever you're gonna prepare your blood smear, class, you need to remember this, how to make a good blood smear. First, you have to make it thick from thin. So if you notice kanina, class, your smear is the label, and you'd add a drop here, then you'd slide it downwards. The starting area, your starting area should be thick. And as you smear it along, as you go down, the final area should be thin. Then it should only occupy 2/3 of the slide, of the entire slide. So like this one, class, if you notice, only the 2/3 of the slide would be occupied. And it shouldn't touch the edges. So it shouldn't reach this part. And there should be no holes. So sa place ng ginawa ko, class, if you notice, may holes. So this is unacceptable, pangit. And there are a lot of reasons for that. I'll explain that later. Now, aside from that, class, you also have to consider the following when making a blood smear. Your angle, your speed, the amount, and the pressure. So let's take a look at one of this. Now, if your angle is too shallow, meaning masyadong mababa, let's say you went at a 20-degree angle, it would become too long. But if it is too steep, masyadong mataas, class, let's say you went to 50 degrees angle, it would become too short. Ulitin ko ha, if your angle is too shallow or too low, it would become too long. But if your angle is too high, the specimen, the smear would be too short. If the speed, masyado kang mabilis to the point na ganito ka magano, ginanon mo, masyadong mabilis, you would have a too short, ikling, too short na smear. But if you're too slow, sobrang bagal mo, you would have a long smear. Then amount, obviously, this is an equal relationship. If the amount is small, the smear will be short. But if it's too much, sobrang dami mo maglagay ng blood, it would be too long. Now, we're talking about pressure, class. So, gaano mo kalakas ismear yung ano. So, the more force, the more pressure you apply, it could lead to a distorted long smear. Bakit siya na-distort? Because you're putting too much pressure and that could ruin your smear. But if you're too gentle, masyado ka namang malumanay or masyado kang soft sa pressure mo, it would become too short. So here are examples, class, of unacceptable peripheral blood films. So the first one would be your chipped or rough edges. Class, normally, class, your appearance of your blood smear should have a tongue shape or a feathery edge. Now, may tanong si Miss Aquino, Sir, sa lab ba namin required ng ganyan na tongue shape yung smear? Technically, no. Hindi kailangan. But, ang reason kasi, class, why you want that to be like, why you want your smear to be like that is to have what we call even distribution. Kasi pag hindi nyo sinunod yung ganyang pattern na thick to thin, baka may mga ma-miss kayo na WBCs, causing your wrong differential count. Then another one would be this one. If you notice, distorted siya. The reason for this is yung medtech nagkaroon ng hesitation. Nag-hesitate siya sa pag-smear niya. Then this one would be your spreader slide pushed too quickly. So masyadong mabilis, making it too long. And then another one for your D will be drop of blood is too small. So masyadong maliit yung blood na nilagay mo. Then that would lead to your short smear. Then drop of blood not allowed to spread across the width. So ito siya, class. Hindi nyo properly in-spread yung blood dito. Siguro parang dito pa lang sa area na to, then in-smear nyo na pababa. So this will happen. And then another one, if your slide is dirty or greasy, mamantika or oily, you could have holes in your slide. And last would be your uneven pressure. So masyadong malaki yung pressure na nilagay mo sa left side compared sa right side. Hindi even. That's what happened. And then dito sa H, nagkaroon ka ng delay sa pag-smear to the point na nag-dry na yung blood. Okay? So remember your unacceptable peripheral blood films. Then by the way, class, we will have a quiz on October 8th covering this topic. It will be a 40-item quiz. A combination of multiple choices, essay, and fill in the blanks. Siguro mga 2 essay lang, class. Then the rest, 25 items ng MC. And then 5 points ng fill in the blanks. Okay, now after you've made your blood smear, class, you have to stain them. Now, what's the purpose of your stain? Your stain would allow you to differentiate the different parts of your WBC. So remember, di ba yung mga granules ng WBC, iba-iba yung kulay. Now, in blood smear preparation, class, we commonly use Romanowski stain. So Romanowski stains, class, is a general type of stain. A general type of stain. Now, for this one, class, we would use your methanol as your fixative. Now, your methanol or your fixative would act as to preserve. Whenever you encounter the word fixative, class, they would preserve the cellular appearance of the cell. Cellular appearance of the cell. Appearance of the cell. Then you have to rinse it with water to remove the excess methanol. Then followed that, class, I apologize for this. This is a typo. You have to put it in your hematoxylin. Wait nga lang. I-edit ko na lang. Then you have to rinse it in water to remove the excess methanol. Followed by that, you're going to put it in hematoxylin, class. Si hematoxylin nyo, class, this is a basic dye. This is a basic dye that would bind to the basic components of the cell. Usually, they would appear purple or bluish in color. Then you have to rinse it in water to remove the excess hematoxylin. Then eosin, you have to binds to acidic component. Now your eosin, class, are acidic dye. And they would tend to produce a pink or red color sa cell. Then you have to rinse it in water and put it in a buffer. Now, your buffer, class, would enhance would enhance the effect of the dye. Effect of the dyes. Okay, sige nga, let's recall your let's recall your WBCs just to test your critical thinking. Your eosine would produce pink or red color in the cell. Now, what type of WBC would apply to eosine class? Sa pagkakaalala nyo, anong WBC would be able to absorb your eosine dye? What type of WBC would absorb your eosine dye class? They would produce pink or red daw. Bakit beso, Miss Abaw? Remember, I'm talking about the color pink or red. Okay. Why eosinophil here? Bakit eyo? Okay, so yeah, they have brick red or pink granules kasi. Now, your granules kasi class have different affinities. They could be basic granules or acidic granules. Now, for your baso, that would be a basic granules because they would appear bluish to black. So they would tend to be absorbed or stained by your hematoxylin. While for your eosine, they would tend to those with acidic components, specifically your eosinophil. Okay. And then again, you put it in buffer. Your buffer enhances the effect of your dye and you rinse it in water. And another type of stain would be your GEMSA stain. Now, your GEMSA stain would be the one you use for your malarial parasites. Now, again, you have to use your methanol, rinse in water, then you have your commercially prepared GEMSA stain. So, you dip nyo lang sa GEMSA stain and you could visualize na your parasites, specifically your trophozoites. Trophozoites ng malarial parasite. So, di ba maraming life stages yung malaria nyo? So, one of the most commonly seen would be your trophozoites. Now, once you have your stained smear, you're going to read it. Now, how would you read it, class? Now, there are 5 types of reading. I won't read them, but I show them to you. First would be your strip or your horizontal method. So remember, class, your vertical line is this and your horizontal line is this. Now, imagine if this is your smear, you're going to read it in a horizontal pattern. So normally, you'll start from the head to tail. So, pagdating nyo ng tail, you would go down. And then so on. So, then you may be asking, Sir, kailan kami magsa-stop sa pagbilang ng WBC? You're going to stop counting your WBCs if you have differentiated 100 WBCs. So let's say nakabilang ka na ng 50 na neutro, 40 na limpo, 5 eyo, 1 beso, 4 na mono. You're going to stop your counting. So that's how you do your strip or horizontal method. So from the head to the tail on a horizontal pattern. Now, your crenellation method, class. Your crenellation would usually, if nakakita na kayo sa movie ng mga castle walls, yung castle walls nyo would have what we call crenellations and they would appear like this. Crenellations would appear like this. But they're very small. So for this one, you're going to start from the bottom, from the upper part, and then you're going to go down like this. And it would encompass, then you count 100 WBCs. Okay? Then, ganito. Yung buong smear na yung aanoin mo. Till you count 100 WBCs. Okay? Then we also have your two-field mender. So sa two-field mender class, very easy lang to. You're going to divide the smear into two sections. Then you're going to count 50 WBCs in one section, 50 in another section, using your exaggerated battlement method. So, ganyan ka magbasa. For this time, you're going to divide it into two areas. Then your four-field mender naman class. So from the word four fields, apat siya. Di-divide mo siya sa 4. 1, 2, 3, 1, 2, 3, and 4. So this time, you're going to count 25 for each section. More accurate to than the mender, the two-field mender. And again, using the battlement method pa rin. Plus in practice, sa totoong buhay, in laboratory practice pag naging intern kayo, what you would be doing most will be your crenellation and your exaggerated method. Yan ang pinakagagawin nyo. Because you would have a total, remember kasi pag magbabasa kayo ng ganyan, you would have a more fields na mababasa nyo. From vertical field to horizontal field and so on. Mas may encompass nyo or mas masasakop nyo yung buong blood smear. Any questions for your reading of blood smear? None. Okay. So this is the picture class. So yun yung battlement method, yung longitudinal or yung horizontal method. Yung step technique din naman namin ito ginagawa. So these are examples lang class of your differential count, the ways of reading your smear. Now, after you've read the smear, after that you've known your reading, how to read the smear, you have to check your slide identification. So tama ba yung name ng patient sa slide sa request? And i-check nyo yung specimen orientation. So you have to check if the sample is lipemic. So if the sample is lipemic, you could see decreased RBCs. If there is a color in plasma, let's say pinkish siya, there could be hemolysis. So you will see a lot of ruptured RBCs, depende. Then the first thing you do before you go to OIO, kasi sa OIO nyo binabasa ang diff count, you check your LPO. Your LPO class will allow you to have a better visualization of your entire smear. Check nyo yung feathery edge for fibrin. So yung feathery edge nyo, check nyo siya if may fibrin. Now, what does fibrin mean? Diba, remember class, your fibrin is the product of your fibrinogen turning into fibrin due to clotting. So it means that your EDTA isn't properly mixed. Because may fibrin. Meaning may clot yung EDTA nyo. So you have to check for that. That could lead to a falsely decreased WBC and can also lead to clumps of red blood cells. Ulitin ko class ha, you have to check for fibrin sa feathery edge. Remember your fibrin, wait lang class, pause muna. Hindi ko pa na-email, sir. Email ko later, sir. I think PRN. So doon na lang. Hindi ko pa alam. In the feathery edge, that would indicate that your EDTA could have clots in them. Clotted yung blood. So you have to reject that and repair it again kasi your WBC would be decreased and you may find clumps of RBC. Then another one would be the verified acceptable number of WBC. So you have to check if merong mga blasts. And one characteristic of your blast class is they are very big. Very big with very big nucleus. So if you see blasts, you don't count them. Then another one would be your verify your staining quality. So your staining quality, if the stain is too dark or too pinkish. May problem sa stain mo dyan. It's either concentrated masyado yung ginamit na powder or so. Then you also have to examine the RBC distribution patterns and shapes. So if you see abnormal shapes of your RBC, if you see microcytes, macrocytes, you would have idea if the specimen is low in hemoglobin and so on. So after that, you've checked the LPO. You're going to proceed now to your oil immersion field. So you have to prepare your blood film with oil. So imagine class, this would be your feathery edge, your smear. So you place a drop of oil, then you read it. Then estimate your platelet count. Not really done class. Hindi naman ginagawa to, but this can be done depending sa technique nyo sa laboratory. Kasi yung iba ang ginagawa class, they would just count platelets. They would count platelets in 10 fields. In 10 fields. So sa 10 fields class, then i-average nila yun. That's how you estimate platelet. But that is not a sure way of doing your platelet count. Then you can also estimate your leukocyte count. So once you've seen na, prepared ka na, nasa OIO ka na, you will classify 100 WBCs. So you will report it as percentage. So let's say you've seen 50 neutrophils, you will report that as 50%. Then keep a separate count for your NRBC. No? So when you see nucleated RBC class, your NRBC, you have to make a different count for that because you may have to perform corrections, yung WBC corrections. Yeah. Then if you see any abnormal WBC, you have to report it. Then you have to grade if the RBC morphology is normal. Then identify miscellaneous abnormal cell. Plus in real practice, sa totoong buhay, itong dalawa lang talaga yung ginagawa niya. Pero may mga cases, if your patient has leukemia, let's say yung patient niya may leukemia, you would be required to check the rest kasi you can see blasts and different abnormal cells. But if the patient is normal naman, you can actually do na lang yung classifying 100 WBCs. Now, in your blood smear class, there are irregularities that may happen. So, one would be your squash or distorted lymphocyte. Last question, based sa ano natin kanina, dun sa apat, yung angle, yung speed, amount, and your pressure. Which among these four would cause a squash or distorted lymphocyte? Pressure. How about yung accumulated white cell? Pwede. Pwede yung amount. Okay. What else? When you say accumulated white cells class, nag-accumulate sa baba ha? Yung pag-smear nyo ng ganon. Speed. Pwede rin ang pressure, di ba? Kasi the more you put pressure in it, pwede silang mapasama. How about your smudge cells class? When you say smudge cells class, these are cells that are flattened. What's the reason? Amount, speed, pressure as well. Sure. Para may idea na kayo sa quiz niyo. How about your disintegrated or ruptured cell? Pressure as well. Okay. Now, another type class would be when your leukocytes are poorly stained. So sabi ko nga kanina, you have to check if the stain is properly. Now, this would usually be caused by incorrect pH of your buffer. Normally class, the correct pH, ang tamang pH ng buffer niya is 7.2. But depending on how it is prepared, if it's commercially prepared, like the Bavarian. But normally it is 7.2. So slightly acidic. Now, if your buffer goes beyond, let's say, goes below, let's say mga 6.9, acidic siya, your acid components, yung mga acid components nyo would would become brighter or pinkish. But if it's more basic, the basic components would become more darker. Ulitin ko, the correct pH of your buffer is 7.2. If the pH goes down, it would become acidic, making your acidic components more pinkish or more brighter. While if your pH of your buffer becomes higher, meaning more alkaline or more basic, it would become darker. It would become darker. Brighter pink kamarjo pag acidic. Then darker blue kapag basic. Brighter pink or darker pink. Pwede rin. Oo. Then there could be also be a improper mixing of stain and your buffer. Now, that's why it's important, class, to always rinse with water. Now, there could be a possibility na, let's say, yung buffer nyo na mix ng eosin. Na-mixan ng eosin. That eosin mixed with the buffer could affect the other cells. And then too short staining period. So if your staining period is too short, let's say, ang normal sa hematoxylin is 45 seconds. Ang ginawa nyo lang is 15 seconds. The hematoxylin dye would not bind properly with the basic components. Again, ulitin ko, pag too short yung staining period, the dyes would not properly bind with their right components. Then this can also be caused, another one would be your precipitated stain. So nag-precipitate yung stain, class dun sa smear nyo. So you may see different colors ng mga artifacts. Now, possible causes for that are unclean slide, drying during the staining period, so hindi mo sinunod-sunod agad yung process, inadequate washing of slide after staining period, failure to hold the slide horizontally during staining. Okay. Now, whenever you're going to read your WBC, take in consideration the following: the cell size. If the WBC is large or small, kasi may mga WBCs kayo class malaki, may maliit. Then you also need to consider the nucleus-cytoplasm ratio. Meron kasi kayo class ng mga WBC na wherein the nucleus would fill the entire cytoplasm. Meron naman kayong mga nucleus class na WBC na may nucleus na lobe. When you say lobe, yan. And so on. Then you also have to consider yung cytoplasmic characteristics, yung color ng cytoplasm. Kung may granules ba, yung color and size of the granules. Sige nga, let's test your memory. What's the color of the granules of your neutrophil? Yung kulay. Give me the exact color. The exact term na ginagamit natin. The exact word class ng color. Starts with the letter L. Ano ba class? Lilac. Okay. So it's lilac ha? Lavender. So, tama naman din, purple naman kasi siya. But whenever you encounter kasi neutrophil class, you proceed with the lilac, yung color, ha? How about the eosin class? Pink. Brick pink. Red, brick pink. Pwede ring orange, depending sa style niya. May brick red, may brick pink, may orange. How about your basophil? Yung basophil niya, class. Uy, basophil. Basophil, ha? Basophil. Basophil, class. Mental health week lang kayo, wala kalimutan dyan, ha? Pwede. It's blue to black. So, blue to black appearance. Pwede rin dark blue. Sige, consider dark blue. So, aside from that class, you also have to consider the shape of the nucleus. So, if it is bilobe, if it is unsegmented. So, when you say unsegmented, walang mga portions. Yung color, yung chromatin pattern. Yung chromatin pattern kasi hindi mo naman yan nakikita. Then the presence or absence of nucleus. So let's tackle your WBC one by one. Now, the most predominant class, pinakamadami, predominant would be your neutrophil. They're also known as segmenters or PMN. What does your PMN mean? Ano meaning ng PMN na class? What does your PMN mean? Okay, polymorphonuclear. So let's analyze the word polymorphonuclear. So from the word poly, meaning many, and morpho, meaning changing in shape, and nuclear, meaning the nucleus. So class, your neutrophil tends to have 2 to 5 nuclear lobes that are segmented. And your cytoplasm would contain fine lilac granules. Now, whenever you're gonna report your leukocytes or your WBCs, there are two types, the relative count and the absolute count. Now, your relative count class is directly proportional. So let's say nakabilang ka ng 50 na neutrophils, that is the 50-50%. But your absolute count class, there is a computation for that. I will teach that to you in a different topic. Now, the normal value class of your neutrophils would be 50 to 70% ng neutron. So, normal makakita class ng 50 na neutrophils sa isang diff count up to 70%. Well, the absolute count would be 1.8 to 7,800 UL or 1.8 times 10 raised to the 9 to 7.8 times 10 raised to the 9 per liter. So this is the appearance of your neutrophil. So if you notice, class, they would have fine lilac granules that are not easily visible. Yan sila. And they would have 2 to 5 lobes. So 1 lobe, 2 lobe. Now let's look at this. 1, 2, 3, 4, and 5. Now this would be the appearance of your neutrophils. So si Mr. Fahad magpapasaliva test. So that's the appearance of your polymorphonuclear cell. Now, your neutrophils, when they are increased, we have your so-called neutrophilic leukocytosis. Now, your neutrophilic leukocytosis can be caused by systemic infection, such as your bacteria, spirochetes, and fungi. Class, we're talking about spirochetes. What type of bacteria is that? Give me the specific name. Your spirochete. Yung pinakakilalang spirochete class. What's the name of that bacteria? What is the name of the bacteria classified as a spirochete? Come on, class. Ideas. Test natin yung recalls niya sa bacteria. Tobes, any ideas? Miss Barcelona? Wala. Hindi mo maalala. Hindi ba natuwa? How about you, Mr. Carl? Do you have any idea? Ojo, any idea, Mr. Camaro? Miss Abaw? Arjen? Miss Banyadera? What's the name of the bacteria classified as your spirochetes? Alala yan. Okay. Miss Melonio, you're typing. Your leptospira. Yes, your leptospira is also considered a spirochete naman. But one of the known spirochete class is your Treponema pallidum. Naalala niyo na? Your Treponema pallidum causes what sickness class? Anong sakit ang kinakos niya? Alam ni Banyadera to, sure ako. Char. What disease does your Treponema pallidum cause? No, Lyme disease is caused by your rickettsia. Okay, syphilis. So your syphilis sa Tagalog ay tulo. Tulo. Now your syphilis is characterized by the appearance of your chancre. Chancre in your genital area. Now, yung chancre nyo class would be characterized by a painless lesion with even edges. So please take note of that. Now, whenever you have your syphilis class, your spirochetes would cause your neutrophils to become increased. How? They would easily detect this and they would try to phagocytize this. Unfortunately, they have what you call axial filaments. Can you tell me, class, what's the purpose of your axial filaments? Any idea? What does axial filaments do? Okay, your axial filaments class, this is another name for your flagella. And what does your flagella do? Swim. Swim talaga. Rough. Movement, okay, for your motility. Tama naman kasi swim talaga kasi mukha naman kasi talaga nagsiswimming yung bacteria. So this is responsible for your motility class. Now, no, hindi mahabol ng neutrophils niyan. Now, since they can't catch it, hindi nila mahuli, they're gonna call for help. They're gonna cause neutrophils to be constantly produced, causing increased neutrophils. Okay, another one would be your metabolic disturbances such as uremia and diabetes. Class, when you talk about uremia, this usually involves your BUN and your creatinine. Now, normally they are filtered sa kidneys nyo. But in uremia, they are no longer filtered. They are not properly excreted. Hindi sila na-excrete ng maayos. Tending to have high amounts in the blood. Now, when there are high amounts of this in the blood, your neutrophils will treat it as an invader, causing it as increased neutrophil. Then there could be also be drug intoxication, physical and emotional stimuli such as your heat, your cold, your pain, your fever, your anger, your muscular activity. So the more you tend to become active, the more neutrophils are produced. Kasi remember, what do you call the substance? Anong tawag doon class sa substance that would cause WBC production? Anong tawag doon? Yung huli nating diniscuss sa lecture. It would stimulate the production of WBCs. What do you call that? No, not the antigen. Hindi hula kayo, class. Unang pumasok sa isip niyo. Substances that would cause WBC production. Starts with the letter C. Isang word lang yan, Jo. Starts with the letter C, class. Alright, very good, Ms. Bosque. You have your chemotoxins. Remember, your chemotoxins would stimulate the production of WBCs, and they are usually caused by heat, cold, pain, fever, and so on. Then we also have your necrosis, hemorrhage, and hemolysis. Now, these three are related by how they would cause what you call an open area. So when there is an open area in your body, say nagkaroon ka ng, huwag na natin isama yung hemolysis class, yung hemorrhage lang and necrosis or tissue destruction. Your hemorrhage class is also known as your bleeding, pagdudugo. Your necrosis or tissue destruction class, this would refer to your tissue death. So, let's say naaagnas na yung wound mo, hindi na gumagaling, you would have an open area in your body. Now, with an open area, there will be increased arrival of your bacteria. And with an increased arrival of bacteria, WBCs will also increase. And since your neutrophil is the one that is most predominant, they would also be produced in plentiful amount, leading to your neutrophilic leukocytosis. And another one would be your hematological disorders. So certain hematological disorders would cause increased neutrophil. One of those would be your leukemia, wherein there is an increased production of your WBC, leading to increased neutrophils. Any questions? None. Okay. Another one would be your neutropenia. So in neutropenia class, there is decreased neutrophil. An example would be of that would be your drug intoxication. Another one would be your ineffective granulopoiesis. Class, when does ineffective granulopoiesis happen? Kailan nangyayari ang ineffective granulopoiesis? Meaning ineffective granulopoiesis, hindi ka na makapag-produce ng WBC or defective yung WBC mo. Now, when would that happen? Kailan yan mangyayari? Any ideas? When does... Okay, walang stimulator. Medyo malapit na. When does ineffective granulopoiesis occur? Ideas lang, class. Wala namang mamamatay if mali sagot mo. Hindi naman tayo nag-squid game na kapag mali yung sagot niya, bang! Okay, so pwede pag immunocompromised ka na. Saan ba napoproduce ang WBC nyo, class? Where is your WBC produce? So, from your answer, when does ineffective granulopoiesis happen? Sabi niyo bone marrow. So what? So kailan? Okay, so when your bone marrow, class, is damaged, this would happen. So when your bone marrow is damaged, you would have ineffective granulopoiesis. Remember, class, when you ever hear the word poiesis, this would refer to your production. So kapag may problema sa production, identify nyo, kapag may problema sa production, you have to identify yung site kung saan napoproduce. Ibig sabihin may problema dun sa site. So your bone marrow could be damaged. And another one would be class bacterial infections, brucellosis and salmonellosis. Now your brucella, class, this is the one that causes your brucellosis. Your brucella, class, is a type of bacteria. A type of bacteria that is zoonotic. Kapag narinig niyo yung word na zoonotic, what does it mean? Whenever you hear the word zoonotic, what does it mean, class? Okay, transfer from animal to human, okay. Commonly, this would infect animals. Sa hayop lang talaga sila, class, dapat. No. But they could transmit it to humans. Now, your brucella, class, could infect humans via two ways. Ingestion and inhalation. Ingestion and inhalation. Now, paano yung ingestion, sir? Since this is found in animals, specifically your livestock. So pag sinabi kong livestock, class, yung mga baka, baboy, and so on, pwede rin siya makita sa dogs and rats. So ingestion, class, is via drinking of milk. Drinking of milk. Joke, maawa ka naman kung raw meat yung papakain mo, yung hilaw na baka. So ingestion of milk from the cows. Then another one would be your inhalation. So, let's say, class, yung dog nyo, dinala nyo sa vet, hinihingal, nagpapant, positive siya sa brucella. Now, what would happen is you would inhale yung droplets ng hingal ng aso nyo, making you infected with brucella. So, sa dami ng sinabi ng explanation, sir, how does it cause neutropenia? Now, your brucella, class, once it enters the body, they would get phagocytized by your neutrophils. Pero ang problema kasi, class, kay brucella, kapag na-phagocytize na siya, imagine ito yung neutrophil, andito yung mga lobules niya. Then ito si brucella. What brucella would do is they would push, ipupush niya sa gilid, class, parang LE cells lang des. Ipupush niya yung lobes, yung nucleus ng neutrophil, killing the neutrophil. Ulitin ko. Si brucella nyo, kapag na-phagocytize, nakain, itutulak niya yung nucleus ng neutrophil, causing your neutrophil to die, making your neutrophil count decrease. Another one would be viral infections, measles and rubella. So, if you have measles and rubella, this is a systemic infection that weakens your immune system. So, if your immune system is weakened, you will have low WBC count. And remember, the most predominant WBC is your neutrophil, causing your neutropenia. Ulitin ko, your measles and rubella are systemic viral infections that weaken the immune system. Now, if your immune system is weakened, there is decreased WBC. And if there is decreased WBC, since your predominant, yung pinakamadami yung WBC is neutrophil, bababa din si neutrophil. Okay? And then another type of WBC would be your eosinophil. Now, remember, your eosinophil would bind to your acidic dye. Thus, they are also known as eos or acidophil. They have a size of 10 to 15 micra and they are segmented, 2 or more lobes. And they contain large reddish, pink, red, or orange granules. Relative count is 2 to 4%. Absolute count is 350 to 650 UL or 0.35 to 0.65 times 10 raised to the 9 per liter. Kaya niyo pa, class? Tobs, kaya mo pa? Dalawa na lang kayo ni Balili nakikita ko. Iba niyang classmates sumuko na. Okay. Tingnan mo na. Di ba may blanks kayo sa niyo, handouts niyo? Sulat niyo lang yung sinasabi ko. Masasagutan niyo yung quiz niyo sa future. Sige lang, okay lang sa'yo. Alam ko naman, bait naman kayo lahat. Okay, this would be the appearance of your eosinophils class. So they would have pink, red, reddish, or orange granules. So you could easily, ang maganda sa eosinophil class compared sa neutrophil, you could actually see yung granules. Now your granules are located in your cytoplasm, di ba? So they could be easily visible. Sobrang dali niya ma-identify. And compared to your neutrophil, di ba neutrophil nyo rin is segmented or lobe. The defining characteristic of it is that the granules are easily visible sa aeon. So madali niyong ma-differentiate agad if it's in neutro or an eo. Sa granules pa lang because kitang-kita niyo na yung color ng granules. Very distinct yung characteristic. Okay. And then another one would be your causes of your eosinophilia or eosinophilic leukocytosis. So we have your different causes. We have your allergic disease class. Where can you find again your eosinophils? Ang part ng katawan. Where can you find your eosinophils again? Lungs. Lungs or the respiratory tract. Respiratory tract and what else? So, dito sila more predominant. What else? Saan pa? Yung isa pa. Hindi, it's not the gastrointestinal. Malapit ka na, Miss Balbagyo. Lower. Lower. Babaan mo pa. Sige, lower pa, Jo. Lower. Lower pa, Mr. Kamara. Sige. Sige, good luck sa kidneys sa Yala. Atay. Spleen. No, it's not the spleen, not the bone marrow. No, not the blood. Malapit ka na, Miss Banyadera. Mamariglan. Lower nga, Miss Ayat. Ano ba? Lower, higher, mamariglan. Reproductive. It's yung ano, tama na yung bladder actually. Pero genito-urinary. Kinalimutan nyo na klasa yung lesson 1 natin, genito-urinary tract. Diba nga kasi nga ang most common WBC sa urine nyo? Thymus. Isakpad, asa ba ang thymus ni mo, oy? Asa ang thymus? Asa ang thymus? Where can you find your thymus? Sige nga. Ipapaulit ko kayo ng anatomy physiology nyo. Hindi nyo alam yung mga body parts nyo. Mamarigla. Kulit lang. Okay, so your eosinophil can be found in your respiratory tract and your genitourinary tract. Now, they would be increased in your bronchial asthma and seasonal arthritis. Now, remember, since they are found in your respiratory tract, if your body would encounter a disorder on those parts, that would lead to an increased eosinophil. Then another one would be your atopic dermatitis and your eczema. So these are types of allergies. And remember, your eosinophils are increased when it comes to allergy. And then we also have your parasitic infestation. So let's test nga yung knowledge niya sa parasitology. What um, what nematode is characterized by the ova? Yung ova niya is looking like a Chinese lantern. Chinese lantern yung ova niya. Miss Canyeda, any idea? A nematode with a Chinese lantern ova. Miss Canyeda, any idea? Naalala mo ba yung parasitology mo? Bigyan ko kayo ng clue class. Bipolar mucus plug. Bipolar mucus plug din yung ganun. So, ganun. Okay, so you're Kuris. Very good. Sino yung class? Sino yung Japanese lantern? Kilala nyo? Kilala niyo yung Japanese lantern, ova? Related sa Pilipinas yan, class. Yung Japanese lantern ova na. No, it's not your Japonicum. Okay. No. Related sa Pilipinas. Come on. Your strongyloides does not have an ova, and not commonly seen your strongyloides. It's not your enterobius, Japanese lantern. Alright, it's your capillaria philippinensis. Very good. So your capillaria philippinensis. Okay, what we call the protozoa with a progressive motility. Progressive motility. Rather, entamoeba pala. Entamoeba with a progressive motility. No, it's not vaginalis. Directional progressive motility. Histolytica. Histolytica. Entamoeba histolytica. What do you call the entamoeba found in the mouth? Di ba meron na entamoeba vaginalis, so sa vaginal tract yun. How about yun sa nakikita sa mouth class? Gingivalis, very good. Okay, what do you call the parasite, the nematode? Specifically the nematode that would encase itself in muscles. Specifically, gusto niya yung mamuscle na part ng body. Specifically, the thighs. Okay, so it's your Trichinella spiralis. What do you call the largest protozoa that can also be found in pigs? Sobrang dami ng silya niyan, class. Sino? Ano yung sino? Hindi ko yun alam. The largest protozoa that can also be found in pigs that has a lot of cilia. Pag nakita mo to sa microscope, mabilis to. Alright, it's your Balantidium coli. What do you call your Sabi, buwa. Okay, it's your Balantidium coli. Now, your Balantidium coli, when found in pigs, anong tawag? Ano ng species niya, class? Becomes what? Right, your Balantidium Swiss. Very good, Mr. Arjun. Now, sir, how does your eosinophil kill or attract parasites? Now, your parasites class would have what you call a receptor sa surface nila. These receptors are designed to be detected by your eosinophils. And when your eosinophils detect these receptors, they would be increased, targeting the parasites. Then we also have your scarlet fever and pneumonia, hematopoietic disorders, and brucellosis. So, brucellosis class, if naalala nyo, sa neutrophils, sa neutropenia siya. But in eosinophils naman, brucellosis can be found with an increased eosinophil. Then we also have your eosinopenia, wherein stress, shock, severe burn, blood loss would cause an decrease. Then we also have your ACTH, or your adrenocorticotropic hormone administration. So your ACTH would cause decreased eosinophils, acute inflammatory states, and hyperadrenalism, or also known as your Cushing's disease. And another type of leukocyte would be your basophil, also known as baso, 10 to 14 micrometers. Yung nucleus niya, class, hindi makita, or rather very undistinct and unsegmented. Contains bluish to black in color na granules. And normally, class, you won't find it in the blood, 0 to 1%. So this is the appearance, class, of your basophil. So this is very easy to identify because of the granules. Kitang-kita niyo yung granules na, class. Very bluish to black. So basophilia or increased basophil can be seen in myeloproliferative disorders, allergic reactions, hypothyroidism, granulocytic, and basophilic leukemia. Allergic reactions, class. What is the name of the immunoglobulin that is usually produced that can be caused by your basophil? So you have your IgE. And another one would be your basophilia, which is decreased basophil seen in acute infections, stress, and following treatment with adrenal glucocorticoid. Hindi ko na siya i-explain, class, kasi pag i-explain ko pa yung iba, kulang yung time natin. I'll try to sing it this na lang sa ibang araw ng lecture natin. Then we also have your stab or your band cell or your staph cell. Now, these are your young neutrophils, class. So you could actually see your young neutrophils sa peripheral blood, kaya kasama sila. So these are non-segmented neutrophils. They are also known as your band cell or stop cell. The nucleus class would appear as curved, elongated, or sausage shape. Similar to neutrophils, they contain lilac granules. So normally you could see them around 2 to 6 sa differential count. 2 to 6 sa differential count. So this is the appearance of your stab or your band cell. C-shape. And another one would be your lymphocyte class. So you have your small or typical lymphocyte. It's almost the same class. Your lymphocyte would occupy the entire cell. Wala rin siyang granules. Remember, they are agranulocytic. They have the darkest blue cytoplasm. Yung sabi ko kanina, class, this is your WBC, and the nucleus would encompass the entire cytoplasm. Buong yan yung defining characteristics niya. And another one will be your big or your atypical lymphocyte. So this is the one that is usually in contact with your antigens, mga viruses class. Whenever you perform differential count class, hindi nyo need na ilagay na small or large siya. Enough na i-report nyo na lang siya as lymphocyte. Because you cannot differentiate them. So lymphocytes lang ang reporting nyo. Siya ang pinaka-second most predominant na WBC. Amounting to 25 to 40% of your WBCs of differential count. So this is their appearance. So the nucleus would encompass the entire cytoplasm. Then causes of lymphocytosis, they're in chronic infections. There are viral infections such as measles, IM, mumps, viral pneumonia. Basta tandaan nyo tong keywords na to. Your neutrophils would be usually used in fighting bacteria. Your lymphocytes would be used in commonly fighting viruses. Your eosinophil would be usually for allergies and your parasites. Your monocytes class is a bit different. They would tend to fight both bacterial and viral. And your basophil class usually involves allergy and malignancies. When I say malignancies class, cancer. So when you have an increased baso, there could be malignancies sa body mo. Then it can also be used in fighting bacterial infections, increase din ang lymphocyte nyo in TB and syphilis, radiation, and blood disease. The lymphocytopenia, impaired lymphopoiesis, so may problem again sa sa bone marrow. Acute pyogenic infections. Class, whenever you hear the word pyogenic, singit ko lang to. What bacteria causes your pyogenic infections? Bigyan ko kayo ng clue. Sige, may nagka-type si Miss Marian. Anong pyogenes yan? Aling S? Ibuo mo. Hindi, it's not staph. Anong strep? Ibuo mo yung yung genus, Miss Banyadera. Ibuo mo. So you have your Streptococcus pyogenes. So your Streptococcus pyogenes would cause your decreased lymphocyte leukemia The reason for that, class, is whenever you have your Streptococcus pyogenes, you will have increased neutrophils. Sa dami ng neutrophils, class, they would tend to decrease your lymphocytes. Then again, another one would be after ACTH administration and irradiation. Class, when would you do irradiation? Anong sakit mo pag mag-irradiate ka? What is your sickness if you have to undergo irradiation? Pulmonya. Not pulmonya. Irradiation. Another word for your irradiation starts is your chemotherapy. So whenever you undergo chemotherapy, class, siyempre you undergo chemotherapy, that's for cancer. Now, what you would undergo in chemotherapy, class, is that they target the cancer cells. Pero the problem is it's not specific. When I say not specific, hindi lang cancer cell yung tina-target. So hindi lang cancer cell yung tina-target, even the healthy cells. And one of those healthy cells that could be targeted will be your lymphocytes, leading to lymphocytopenia. Again, pag irradiation, this is also known as your chemotherapy. This would be related to your cancer cells, wherein they will target your cancer cells, but it's not specific, causing to target also healthy cells. Healthy cells. Specifically, your lymphocytes. Then the last one would be your monocyte. It contains a single nucleus, partially lobulated, deeply indented, or horseshoe shape. Nucleus stains less densely than other WBC. Cytoplasm is blue-gray with ground glass appearance. So tandaan nyo, class, yung ground glass appearance. Pag lumabas yan sa board exam in the future, pag nag-take na kayo, lumalabas yan, class. That would be your monocyte. Relative count is 2 to 8%. So this is the appearance of your monocyte. So if you look at the cytoplasm, it would appear like a ground glass in appearance. And by the way, class, this is your biggest WBC. Siya ang pinakamalaki niyong WBC. They have a ground glass cytoplasm. Ma-identify niyo yan agad, class. Pag sinilip niyo sa microscope, sobrang laki. Then monocytosis can be seen in viral, bacterial, rickettsial, and protozoal infection. So your monocytes, class, is more of an all-around WBC. Can actually kill. So if napanood niyo yung anime na Cells on Us, Cells in Work ba yun? Ang title lang mismo niya na, Cells at Work. If you notice, yung mga monocytes niya lumalabas lang yan in very special cases of disorders. Pag hindi na kaya ng neutrophils niya, doon sila nag-a-assess. Then monocytopenia would be drug therapy with prednisone. Now, your prednisone would inhibit or kill monocytes and can also be seen in hairy cell leukemia, decrease sa hairy cell leukemia. Conventional way, class, so sabi ko nga, whenever you're gonna count your WBC, it should be in percent. But if you want it in SI, you have to multiply it by 0.001. Let's say you found 20 neutrophils and you want that in SI, so you multiply it by 0.01. Hindi 0.001, class, 0.01. So 20 times 0.01, you get 0.20. And the final WBC count nyo dapat class is 100 WBCs lang. Ha? And this is your normal values of your differential count. So kindly memorize them. They will come out in your quiz next Friday. So that ends our activity 4.1. So we still have time. I will show you